Okay, ankle and associated tendon pain. If we have some restriction through the front of the ankle, this really responds well to mobilizing. We can try and move this talus, we can get it to glide. There's various techniques that we can use on the talus itself, on the malleolus, and also into the subtalar joint, into the foot. Will all help free this area up. We can do a steroid and hyaluronic acid injection. So whether we're trying to reduce the inflammation from the steroid or improve lubrication with the hyaluronic acid, can be helpful in just taking away the pain and restoring some lubrication into the joint. Again, then we can get in and mobilize this. The peroneal tendons and the tibialis posterior tendon are going to need offloading. So again, orthoses are the best way to control this. So if the foot's going to the outside, we can use orthoses to bring it back in. If the foot's pronating too much onto the inside of the arch, again, we can use orthoses to try and hold that foot position. These will be combined with rehabilitation as well. So with the orthosis to try and take out some of the damage in movement, but then we have to restore good function. So an early basic sort of rehabilitation package, building up into a standing, walking and running gait re-education as well is often required to help those. Achilles tendon, similar type of situation. We can use orthosis to help control movement that's aggravating the Achilles tendon. Always rehabilitation has got to go in with it, and injections, various types, very rarely steroid, but we do use hyaluronic acid, we use high volume. Often the issue is the tendon and the sheath have become bound down together. So the injection is used to separate the teeth off the sheath off the tendon. Shockwave also works really well with tendons. So Achilles tendon, peroneal or tibialis posterior, shockwave is really good at re-establishing that healing mechanism. So what we're trying to do is restore good function back into the tendons, and for this they have to be moving. So anything we can do to get the tendon moving, it will start to look after itself. Tendons do not want to be rested. They've got to be working. We've got to be as active as we possibly can without causing more damage. It tends to mean we have pain for a little bit longer, but we're restoring function and you're getting back into activity a lot quicker. If you're resting your tendons, have a really good think about if it's actually beneficial. We've got to get those tendons moving. So the rehabilitation is a really important part of that treatment.